Like as I was logging off saying, "Don't leave," and then I was off. I feel like a terrible person. All right. So for your case, you have just admitted a 24-year-old female who sustained a T3 Asia A paraplegia in a car accident 2 weeks ago. She was pregnant at the time and delivered a healthy 38-week-old baby girl who is home with her husband. During your initial rehab H&P, she expresses concern that she feels too short of breath to work with therapy. What additional history would you like to know at this time?
I would like to know, first I would like to know if she has any other past medical history, any history of respiratory issues. I would like to know how the delivery went. So I want to know if there are any complications with the delivery. Was it vaginal? Was it C-section? I want to know when the pregnancy, or sorry, when the delivery was, because the injury was 2 weeks ago. I want to know what the delivery was. I want to know since the delivery if she's had any other complications. I want to know if she is I want to know, as far as the spinal cord injury goes, I want to know if there were any surgeries associated with that. I want to know her hospital course since that spinal cord injury, if there's been any complications, any other issues with respiratory, anything that could have affected that. I want to know, and then I want to know about her shortness of breath. I want to know what's causing it. If there's anything that makes it better, makes it worse, is it positioning? I want to know if it comes on just with exertion or if it's happening just at rest. I want to know if there's any fevers associated with it. I want to know any other, review of systems. I would mainly start with cough, chest pain, abdominal pain. I want to know her bladder management, what she's doing for that. I want to know how she has a bowel program. What is she doing for that bowel program? I want to know when her last bowel movement was. And if she's had any constipation since she had the injury. I want to know how her diet is, how much she's taking in. I want to know if she's breastfeeding.
Okay. Yeah. So moving on, the patient reports that the shortness of breath has been increasing gradually over the past week. There is no associated pain or diaphoresis, but she has been started on Zofran for nausea. She has never had this before. She has not really been active enough to tell if the shortness of breath gets worse with activity. She smoked 1/2 pack per week prior to her injury, but has never been evaluated for lung disease. She denies any family history of VTE, and she transferred on Lovenox 40 milligrams daily. She's wearing a brief for postpartum bleeding and has daily bowel movements, but can't tell you when she's gone. Nurses are performing an in and out cath each shift. What would you include in your physical exam?
I would start with my just general appearance, how she looks. I want to know cranial nerve exam. I want to go to the pulmonary exam. I want to listen to her lungs. Want to also listen to her heart. I want to do an abdominal exam, assess for any distension. I know she says she's having a daily bowel movement, but she could still have constipation. I want to do a strength exam. I know, and as well as reflexes. I think that's where I would start.
Okay. The patient is afebrile. Her blood pressure is 120/80, heart rate is 90, oxygen saturation is 95% on room air. Her heart is regular with no murmurs, gallops, or rubs. Her lungs are clear to auscultation, but diminished by basilarly. Her abdomen is soft, and the patient denies any pain, but gets spasticity with palpation over the right lower quadrant. She has mild, symmetric 1 to 2 plus pitting bilateral lower extremity edema. Her pedal pulses are intact, and her capillary refill is normal. What is your differential diagnosis for her dyspnea?
One of them would be pulmonary embolism, especially with the pitting edema in her lower extremities. Sorry, to clarify, was that bilateral?
Yes.
Bilateral pitting edema. Okay. All right. Well, still could have pulmonary embolism. She could have constipation, especially associated with that left lower quadrant tenderness in her abdomen. She could still have, lower on my differential would be pneumonia, but still could have it. And it could also be due to her spinal cord injury, like a I'm forgetting the term for it, but basically the fact that she's not able to use all of her abdominal muscles to breathe, it acts kind of like an obstructive, it can be harder for her to breathe because of that.
What tests and imaging would you like to order to better evaluate this patient?
I would like to get a KUB. I would like to get and then I'd also like to get bilateral lower extremity Dopplers, as well as we already have the chest. I guess I would start with that and possibly follow that up with a CT angiogram to like a CTPE to assess for pulmonary embolism. I would like to, was the question, sorry, just about imaging, or was it a diagnostic test in general?
What tests and imaging?
Okay, other tests I would like to get CBC. I'd like to get a BMP, and yeah, that's where I would start.
Okay. The patient's CBC, CMP, ESR, CRP, and BNP are within normal limits. Her EKG shows normal sinus rhythm without an ST elevation. Her D-dimer is elevated at 76. Duplex ultrasound is negative for DVT. CT chest with contrast is negative for PE, but reported as significant for pneumonia versus atelectasis with recommendation for clinical correlation. Her KUB shows significant stool burden. What is your treatment?
I'm going to first, because she doesn't seem to be having any other systemic symptoms of infection, I don't think I'm going to treat that possible pneumonia. But I am going to increase her bowel regimen. So depending on what she's taking orally, I would probably increase that to, as well as increase add a suppository if she doesn't already have it, possible enema, to try to decrease the stool burden. And then I think I will, I guess, follow clinically. Like I said, I don't think there's a need to treat the pneumonia right now, but if symptoms worsen, then I would possibly add on an antibiotic to treat the pneumonia.
Your hospital system is recommending a quality improvement project to decrease the risk of complications shortly after transfer to inpatient rehab, and would like you to serve as the project lead. Please discuss who might be important individuals to include on this project and what your first steps might include.
This is to help with the transition from acute to inpatient rehab?
Acute to inpatient.
So, and the question is who would I include in the team?
Who might
Okay.
be important individuals to include, and what would your first steps, or what might your first steps include?
I think important to this would be first the attendings on the inpatient side that are involved in typical care of patients that would come to the inpatient rehab. I would like to have the head of therapy at the inpatient rehab be a part of this. I'd like the head of nursing to be a part of this, the social worker from our inpatient rehab service as well. Um, I would like to have the social worker also from the inpatient side be a part of that team. Um, I and then who else would I want? I would like a lot of people, but um, I think I'd start there. Yeah.
For this last session, we will engage in role play of a patient interaction. During the course of your patient's rehab stay, she refuses therapy, and the nurses paid you to share that she is distraught and won't discuss the reason for her referral. You go to see her. Between her tears, she manages to share, Dr. Brown, I came from a big family. I always thought I could have a big family, and now my daughter is going to be an only child. I just don't know if my marriage can survive all of this. What am I supposed to do?
I'm sorry that you're feeling that way, and I know you've been through a lot. I know that having this life altering accident you had is a big change, and also having your first child is a huge change. So I know that there's a lot for you to process. Uh, can you explain to me, I guess, just so I understand your understanding? It sounds like you're worried that you're not going to have more children. Is that what you're worried about?
Well, yeah. I mean, I can't even move. Like how and I don't have I don't even think people with spinal cord injury can have babies. Like, isn't that impossible?
I think that's a great question you have. Fortunately, there's a lot of hope to have in that realm. I think that, well, first of all, we do know that patients with spinal cord injuries still can have children. Just because you have a spinal cord injury does not mean you won't have children. Plenty of people go through and can have uh, healthy pregnancies uh, and still have children. It means that you will have to have more care, more specialized care during those pregnancies and during your delivery, but it's not something that will stop you from having children in the future. I think that as long as we can connect you with a great spinal cord injury trained physician, they're really going to be able to help you along this way and help you get to the point where you're going to be able to have a healthy pregnancy and healthy delivery. But I think that's one thing you don't have to worry too much about.
All right. So that is time. Um,
Oh man.
so I tend to, for debriefing these, I tend to kind of go point by point and asking what if you think it went good or bad or what your thoughts are on it. And that way,
Yeah.
we can be systematic about it and get through the whole thing. So
Yeah.
data acquisition for the first part, history. How do you feel like that one went?
I felt like that one actually went pretty well. That one, I felt like I got most everything I needed to.
Yeah, and I tell residents this every time, like that's your time to just kind of settle out the anxiety and the nerves of starting a new case. Because it's like the basics that you learned in your first year of medical school, which you did a great job with. Like just start listing what do you take on an H&P? You're gonna ask the review of systems and you're gonna go system by system. And you did a good job of including like the pertinence up front, but then just casting a really broad net. So I think if anything, and these are minor things, like I probably would have asked about the blood thinner history in a new spinal
Oh
cord
yeah.
injury who's had a delivery, what did they do?
Yeah.
And then asking about like the risk factors for clots, family history, tobacco, like that kind of stuff. I sort of stacked this one because, of course, you could have amniotic fat embolism from long bone or the traditional
Yeah.
blood clot. So I'm trying to make you think broad when I put this together. But you did a great job hitting all of those. Physical exam. How do you feel like that one went?
That one was a little not great. I think I got pigeonholed. I was just thinking just about the lungs pretty much and like the abdomen, and I kind of forgot about like vitals and,
Right. I
checking
saw
the
twice.
extremities.
Yeah. The vitals and the extremities, it was clear on your face when I read those off. You were like, oh God, how did I miss
Yeah,
those?
yeah,
Um, I think we get comfortable in a rhythm. Vitals get automatically imported into a lot of our things in our notes and things that we do is on a regular basis. So I think a lot of people fall into that trap of forgetting to ask vitals. So that would be one recommendation is to always ask for the vitals. There's a reason
yeah.
when we SBAR people, we start with vitals. And then yeah, lower extremities was the only other thing. You got, the other stuff though. And again, same thing. Like there's a reason we do this in a systemic order, so that you don't miss things. So um, sort of get into your rhythm and just ask it. What about differential? How'd you feel that you did there?
I did okay. I think I, missed a
Yeah,
couple, but I think I got most of it.
you did. You had everything. Well, okay. So the zebra I had on there was postpartum cardiovascular. But you got the bread and butter, which is pulmonary embolism. Atelectasis is describing it, even if you don't remember the term. Pneumonia, bowels. So you had all of that. Tests and imaging. How do you feel like that one went?
Uh, Also okay, not great.
I think again it's one of those where it's the in the moment you're not sure where you're going with it. Like I could be wrong, but I do take notes and you didn't ask for a chest x-ray. I think you thought you asked for a chest x-ray.
Well,
You
I
asked
thought
for a
they had one.
KUB and a CT.
Didn't they
Um
already give a chest X-ray with the bilateral
uh-uh.
atelectasis? Oh, that was just the
Uh
pulmonary exam that they said.
yeah. Yeah. So just I think again this is why you just practice a bunch of cases. But
Wait, what
it's
what what was the one? Because doesn't the radiologist say to correlate clinically on it?
that was the response after I asked for this question.
Ah, okay, all right, okay, all right.
But again, like this is just, remember it's shotgun. There's like 10 possible points here. If
Yeah,
you miss one, it doesn't sink you. So you and then you added the labs in, and I think that that's something that I see frequently is people kind of either grab to lab and then kind of forget imaging, or grab imaging and kind of forget lab. So just make sure that you're getting both to rule in or out your differential. Um, so I didn't see if you were taking notes, but in the
I
past you've
did a
been
little bit.
allowed
Yeah,
to take notes. Yeah. And I found that helpful when I did it myself, because that way, if I know what my differential is and I'm not trying to go off of memory, I'm like looking at my differential on a piece of paper. I can be like, okay, so this would help me roll in or out. This would help me roll in or out. So don't be afraid to use the tool that you're allowed to use.
okay.
Um, but yeah, you got, I mean, most of this. Good job. And then patient management. How do you feel that one went?
Patient management. Again, it could have been better.
So this one was a little bit tougher just because there wasn't like meds or things to order. So the other things that I had besides bowel clean out was like incentive spirometer, abdominal binder to help with the diaphragm support, because
Yes.
this is postpartum woman. So she has the spinal cord on top of the laxity of having had a baby. Smoking cessation, because she was a smoker when she came in. So it's
Oh
it's
yeah.
actually more, the stuff that I think I have no doubt you would do all that, Nick, if you were working with this patient. It's just in this kind of artificial environment, you don't necessarily think of it.
Yeah.
Um, Systems based, the quality improvement project. How do you feel like that went?
Not great.
What was not great about it?
I don't know. I felt like I mean, I kind of had some, but I felt like I was missing pieces. I just couldn't think of who else I would want.
Yeah, I mean, so you identified people, like any kind of project, you're looking for the stakeholders. So that's what you did. And so you definitely get points for looking for stakeholders. Um, I would say you need a sponsor on any project. So the person that can actually authorize the change, like the medical director of maybe both hospitals in on it.
Okay.
And then for initial steps, like I know that you would do this. It's defining our problem. So you might talk about how you would define the problem because they didn't give any context.
I didn't even, I guess I only caught the part of the question that was like, who do you want on the team?
Yeah. So notes, jot
Yeah.
down what points you have to get asked or you have to address. And then the role play. How do you feel like you did on the role play?
I feel like I did good on the role play.
I agree. You've got a great bedside manner. You quickly kind of I love that you actually asked her to clarify. That's a big one. You started out with, validating the feelings, trying to empathize, and then asking to explain to make sure that you're addressing the right thing. And actually in practice, I think that's a huge one that a lot of times, all of us fall into the trap of thinking we know what the patient's concerned about. And we open Pandora's box because maybe we go off on a topic they weren't even thinking about. So,
Yeah.
so I think that you did a fantastic job with narrowing it down, bringing back hope, being very factual and very concrete in your answers. So I think you got full points from me on that one. You did great.
Awesome.
So thoughts in
Cool.
general on the case?
I mean, this is just really good for me to do and practice. I just know that next year I'm going to have to like really practice this a lot because I'm not good at this on the spot talking about it. So
Yeah.
I've got a lot to work on.
So get together, fellows where you're at, or even your graduating class, because your oral exam is over Zoom now. So practicing over Zoom actually makes a lot of sense.
Yeah.
And just presenting each other cases, and taking turns being both the case writer and the examinee, I think is the way to go on it.
All right. Awesome.
Should we jump back on the other one?
Yeah, though I don't know. Yeah, I guess we can.
Or
try
they
and see
might
if
still be
there's-
talking. Maybe we should wait a little bit.
Yeah, I don't know if there's much else we need to
Okay.
to do.
I'm happy to jump
I mean,
back on if you want, or